The word meaning of Samsiddhi itself is complete knowledge. Samsiddhi is one of the greatest platforms for all great minds of Ayurveda coming together, where one can harness the in-depth knowledge of Ayurveda. Samsiddhi will envisage to develop a new dynamics in realm of Ayurveda. Today is the 11th day of Samsiddhi National Web Conference 2020 conducted by Ayurveda College Coimbatore and powered by DIKSHA e-learning. Let us start the session with the blessings of God. Om Namami Dhanvantarim Adidevam Surasure Bandita Padapatmam Loge Jararubhaya Mrityunasham Dadaramesham Vividaushadinam. Now, I invite Dr. Sudhiraj N., Principal, Ayurveda College, Coimbatore, to greet the gathering. Over to you, sir.
Thank you. A very good evening to all. Welcome to our national webinar series Samsiddhi 2020 conducted by Ayurveda College, Coimbatore and powered by DIKSHA e-learning. Thank you all for finding time and joining with us today. Today, we are graced with the presence of great teacher, Dr. P.T. Chacko sir, for our session. Sir will be sharing his experience on the topic Common Balaroga and its clinical management. Chacko sir is a mentor to our college. In the beginning of our college itself, sir was a teacher here, maybe in 1980s. And after that, he had done his PG from Jamnagar in Kaumara Bhritiya, and he worked in various reputed hospitals as a clinician. Later, he joined as a principal in Coimbatore Ayurveda College and retired as Dean of PG Studies. He is a well-wisher of our college. He is a real hero, teacher and mentor for all the staff and students of Ayurveda College, Coimbatore. With immense pleasure and gratitude, I welcome you, sir. I welcome all the participants from all over the India and abroad who join with us. Thank you very much. My special thanks to all the faculties and students who had worked hard as a team for making this event a grand success. Thank you very much.
Thank you so much, sir.
Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions to be raised in the link provided in the chat box. Questions raised in the link will be cleared at the end of the session. Next, I would like to invite Dr. Tulya Mohandas, Vice Principal, Ayurveda College, Coimbatore, to deliver the welcome address. Over to you, ma'am.
Good evening, everyone. I am very happy to welcome Dr. P.T. Chacko, retired Dean and former Principal of our college, to Samsiddhi 2020. Chacko sir is a good administrator, practitioner, and a good teacher who guides and supports everyone when needed. We are all blessed, sir, to be here to share his knowledge and enlighten everyone on topic common Balarogas and its clinical management. Again, on behalf of management faculties, students of Ayurveda College, Coimbatore, and all the participants, I extend my warm welcome to you, sir.
Thank you, ma'am. It's a great pleasure for me to introduce our beloved Dr. P.T. Chacko, retired Principal and Dean of Academics, Ayurveda College, Coimbatore. Sir completed UG from Ayurveda College, Kottakkal, and PG in Kaumara Bhritiya from the Gujarat Ayurveda University, Jamnagar. Formerly, he was Senior Physician in the Ayushman Ayurvedic Trust, General Manager of Technical Section in Ayurveda Pharmacy, Coimbatore, and he is a member of the technical expert team which conducted the first scientific study on Kudi Praveshika Rasayana Chikitsa. He was also a member of the Board of Studies of the Dr. MGR Medical University, Chennai. He started his teaching career from Ayurveda College, Coimbatore, and later was appointed as principal in November 2018 and continued his services even up to retirement as Dean of College till 2019. He is a renowned personality in the field of Ayurveda and needs less of an introduction. On a final note, he was the backbone of Ayurveda College, Coimbatore, and was the fatherly figure who made AVC feel like home to all. There was love and wisdom in each word he spoke. Students, faculties, and other members of Ayurveda College, Coimbatore will love and cherish even his rebuke in the most lovable way. Now, I would like to hand over the session to you, sir. Over to you, sir.
Okay, a very good evening to everybody, and thank you for joining me in this webinar. And for giving me a chance, I would like to thank Dr. Sudhir and the entire team, Dr. Tulya and Anandasai and all the team members. And I would like to start with the subject, that is Kaumarvritya. In the college days, usually many of our even this, in our days also, many people doesn't give much importance to this branch of Ayurveda because it was only a subject, a small part of the Prasudi and Kaumarvritya. Always it was together, and only a small portion was being taught in the colleges. And now only after the CCM syllabus and everything came, more importance was given to Kaumarvritya, and after starting the PG in Kaumarvritya in BHU as well as Jamnagar and Trivandrum, a few of my students also have gone for PG, even my friends and my seniors, they have also undergone the PG in Kaumarvritya. I would like to start with a small introduction about Kaumarvritya. As all of you know that it is the most important branch of all the Ashtangas of Ayurveda, and it's one among the 8 branches of Ayurveda. In the context of Vajigarana, it is said that a person without progeny is like a tree without branches and fruits, serving no purpose and its existence. Achaya Pudi Kusuma Bhalena Rehidodruma Yata Iga Chagascha Nirabatyas Tadanara. But if the branches are lame or the fruits are bitter, the tree would still be looked down upon by the society. So it is not merely giving birth to a progeny that matters. Rather, more important is that the progeny should be capable, both mentally as well as physically, to an active participant, to be an active participant of the society. For this fact that today's children are the future of the family as well as the nation tomorrow. Importance of Kaumarvritya is children being the building blocks of the nation as well as the most vulnerable group of the community, required to be handled with utmost care and concern. Hence, pediatrics, the branch of medical science dealing with their health and disease, is indeed of special significance. Kaumarvrityam Ashtanam Tandranam Adyam Uchide Ayurvedasya Mahado Devanam Iva Evraba. That is Kashipa Samhita in Vimanasthana. Kashipa told that it is the most important branch of Ayurveda. Acharya Sushruta defines Kaumarvritya as Kaumarvrityam Nama Kumarabharana Dhatri Kshira Dosha Samshodhanartham Dushthastanya Graha Samuthanam Javyadhinam Upasamanartham. That is in Sushruta Sutra he has mentioned. And the health problems of children are different from those of the adults because of the following reason. As all of you know, because of their Saugumaryada, that is, children are highly vulnerable due to Sugumaratva. Their body is very tender and soft. And Alpakayada, lower body mass index in comparison with the adults. And Sarva Anna Uvasevada, that is, children cannot consume all types of food. Abadipakwa dhadu, that is, immature dhadus. And dosha dusha mala alpada. Qualitatively and quantitatively, doshas and dushyas are less in their body. Asamatva agada prana dosha dhadu mala aujasa. Equilibrium of functional and structural entities of children is unstable. Ajada Vyanjanam, children have not developed their secondary sexual characters. And Ahara Sankarat Aniyada Vanni, that is, status of Agni in children is unstable. And they are not acclimatized with the different states of food material, solid, liquid, semi-solids, etc. And Madhura Satmyam. Children are more fond of Madhura Rasa and it yields better health in them. Vak Cheshtayor Asamarthyam. That is, children cannot properly express their needs through language and action. Now coming to, because always in our clinical practice, we usually confront with a very emergency situation when the panic patient, that is the parents and the relatives, they come running to a pediatrician to get some relief for their child, because mostly they will not be able to express their discomfort. Emergencies in pediatrics not merely test the experience and judgment of the pediatrician, but also his ability and temperament in coming to a quick decision, because time will be very limited. We have to take quick decisions and administer the medical emergency, attend to the medical emergency very fast. The young patients themselves are hardly expected to volunteer, and they will be only screaming or crying. They will not even listen to what our advice or whatever we are asking them, and cooperate. The patients seldom know the relevant details and are mostly likely to aggravate and try to infect the doctor with their anxieties and fear. The parents who bring the child, they will give a story which may not be completely dependable. And sometimes to get more care and attention from they think that they will get more care and attention from the pediatrician if they exaggerate the condition. So it is because of that they will be exaggerating. So we have to have while taking the judgment, we have to be very careful. No wonder that then that these emergencies offer a lot of detection work. We have to be a very good detective in finding out the actual discomfort of the child. The best person to give the history is the mother of the child, or someone who is closely attached to the child, or the vet nurse. If the child is old enough to communicate, his information can also be considered. If he is a grown-up child, then we can ask him some leading questions can be asked, and he may give some information. And this will help us to arrive at a proper diagnosis. And understanding the the diseases of children, it is a highly specialized work. The clinical presentation of a disease in children is in sharp contrast with that of the adults. Because as we have considered the factors, the main differences between the adults and the children. Even among children with a similar dosha dushya constitution, the nature of the disease varies according to the age. For a small baby, it may be different. They will be showing different signs and symptoms, whereas a slightly grown-up child will be showing the symptoms will be, they will not be able to express it, they will be able to express it more clearly. The clinical skill of the physician should be highly competent enough for performing the Trivida Pariksha, that is Darshana, Sparshana and Prashna Pariksha in children, as they are with dosha, dosha, mala, alpada, because all these it is as in the beginning I told you, they are all with very tender body tissues, as well as dushya will be, and mala, everything will be in the very tender stage. And vak cheshtayor asamartyam, and also purva rupa and lakshana may be different in different children, because the samprapti is variable in children. Shishos Tishna Adishna Sarodhana Chaye Drujam, the severity and lightness of the disease has to be assessed by the cry of the child. Usually, from the cry, we have to make out how severe is the condition or how serious is the condition. Swayam Sprushed Brisam Desam Yatra Jas Parsanakshama Tatra Vidyad Rujam Murdinu Rujam Cha Achinimilanad. This is mentioned in Ashtanga Hridaya Uttarasthana. That is the difficulty, the disease of the child has to be inferred. Whichever area the body he touches, or while we touch a particular part of the body, the baby shows more signs of agony. We can make out that there is some problem in that part of the body. If the baby closes the eyes, often we should suspect disease is somewhere in the head. Hridi Jiha Aushta Dashana Shwasa Mushti Nibhidanehi Koshte Vivanda Vamadhu Tanadvesha Andhra Kujanehi Advana Prishta Navana Jataro Unnamanei Ravi Vastau Gukhyejam Inmutra Sango Trasa Digikshanehi. If the baby bites its tongue and lips, it shows breathing difficulty, and clenching of the fist shows that a problem is with the heart. If there is constipation, vomiting, aversion towards breastfeeding, barborigamy or sounds from the stomach, sounds from the intestine, bloating of the abdomen, tries to lift the body from the bed, abnormal body bending shows pain and abnormality is with the stomach. Constipation, block to normal urination, jittery movement, confused look to different directions shows the problem is with the urinogenital system. Newborns and infants exhibit an amazing capacity to cry, and if there is a cause, it may be even a scream or howl, to the agony and concern of not only the parents, but also the neighborhood. So when a child is in agony, or when he is affected by some disease, he only knows to cry or scream. And this will make the parents and the neighbors in a very pathetic situation. They can only watch the baby cry. So they will be running to the pediatrician to get some relief. Though the amount of crying much depends on the individual. One agrees that this weapon is used really intelligently and quite economically. And this is individualistic. Some people, some children, they will be more able to bear with the condition of the disease. Common causes of diseases of cry in children are hunger or thirst, intestinal colic, intussusception, that is because the intestines may go into the upper part of the intestine, acute otitis media, distension of abdomen, retention of urine, severe upper respiratory tract infection, bronchiolitis, herpetic stomatitis, fall on the head, sprain and fracture of bones of the limbs, poliomyelitis, convulsive tendency, pyelitis, especially in female child, meningitis, peritonitis, fissure in ano, excoriation, itching, dermatitis like scabies, diaper rash, prickly heat, foreign body in the respiratory passage, paroxysmal tachycardia, discomfort from solid linen, wet diapers, and warm and humid environment, insect bite, hyperpyrexia, fever of being left alone or separation from the mother. All these are the causes for a child to be in discomfort, and he only knows to cry to show his reaction towards that. So we have to go into a preliminary investigation to find out the cause of the cry. So the bowel movements and the maturation, a feeding schedule, recent changes in the food, foreign body aspiration, etc., has to be looked into. We have to inquire with the parents or the relatives who have brought the child, whether there is any change in the feeding habit or recent changes in food, or any is there any chance of engulfing or swallowing any foreign body, and a history of a fall. Sometimes without the knowledge of the parents, the baby would have fallen from the bed, and contact with a case of poliomyelitis. Maybe some of their relative child would have been suffering from poliomyelitis, and they would have gone there, and there can be cross infection, and measles, diphtheria, history of infection. We have to go into the detailed history of this infection, ear discharge, if any. We have to look into the ear, past history of retention of urine, pulse rate, temperature, respiration, myocarditis, and paroxysmal tachycardia, hyperpyrexia, bronchitis, pleuritis, infections like herpes zoster, and other painful conditions, traumas, fractures, etc. These conditions will alter pulse rate, temperature, and respiration. Abdominal distension, intestinal colic, obstruction, and peritonitis, perforation of the intestine, appendicitis, acute mesenteric adenitis, colitis, etc., will be the cause of abdominal distension. Examination of the genital organs like penis, vagina, anal region for ulceration or cracks, paraphimosis in small babies, maybe the prepuce will be sticking, and there can be phimosis and too long prepuce, and perianal abscess, fissures, excoriation of the anal region, and this can also cause pain, and that may be the reason for the child for a scream. Examine ear and nose and throat, otitis media, diphtheria, and tetanus. This condition, and foreign body, if there is anything blocking, because some beads or some small, what you call that, glass balls, or this, the children while playing, sometimes they may put into the ear or nose. Eye and ear trauma, stuffy nose, sinusitis, and the muscle stiffness, especially in poliomyelitis and conditions like that. There can be stiffness of the muscle, tenderness, paralysis. For signs of pre-paralytic and paralytic poliomyelitis and other spinal disorders. Examination on these lines will certainly reveal the cause, and the treatment will differ accordingly. Then if the case is not manageable at our level, it is better to refer the patient to the concerned specialized center. It will avoid unnecessary resentment from the and criticism from the part of the relatives. We should not be overconfident, or it is not a matter of what you call that, self boosting, that just telling the parents that I will manage it. It is better always, if it is not possible to manage with us, to refer to the next specialized center. And some Balarogas and its management. And as you, I think many of our Ayurveda friends know, childhood is divided into various stages. The first stage is Garbhagala, or fetal life. And then comes the Kshirada, that is the infant entirely on milk diet. And Kshira Annada, the infant on milk as well as other solid food items from 6 months to 2 years. And then comes the Annada, that is mainly on food apart from milk. Solid, mainly the child will be able to take solid food from 2 to 16 years. This period is further divided into Bala, that is a preschool child, that is from 2 to 5 years, and Kumara, a school child between 6 to 16 years. And now, from this, we can see that the classification of children is mostly based on the nature of food taken by the child. Kashyapa says, Garbha, Bala, Kumarakyam, Ityeda, Trividam Vaya, Yevanam, Madhyam, Vriddham, Edacha, Trividam Guna, Varshavara, Shirava, Syat, Yavat, Pibadi Vapaya, Vayastad, Balam, Asyacha, Yavat, Shodasha Varshiga, Annada, Sarva, Eva Syat, Kaumare, Vayasistida, Adaparam, Dadu, Sattva, Vidya, Parakramehi. This is Kashyapa Samhita describes this. In Ashtanga Hridaya, in Ashtanga Hridaya, Vagpadacharya says, Trividam Kadido Bala, Kshirano, Ubhayavartana. Vayasas Twa Shodashat Balam, Dhatri Indriya Ojasam Vriddhi, Rasas Tade Madhyam, Asaptade Madhyam, Tatra Vriddhi Paramshaya. So here, up to 16 years, the child is considered to be Bala, and after that, up to 70, it is the Madhyama, and after that, the Chaya, that is Vardhakya comes. And Charaka and Susuda also considers Balya up to 16 years. And pathogenesis in children. Generally, as we see that the doshas will be having their aggravation according to the Vayoho Ratri Bhuktanam, Te Anda Madhya Adi Kramad. It has been clearly described in our text that Vada, Pitta, and Kapha dominates during the last, middle, and first or early stages of age, daytime and night in our body. So, due to the speciality of age, Balya Avastha is a Kapha predominant state. Even though Kapha predominates, Pitta and Vada also gets disturbed in the pathogenesis of the disease. Naiga dosha stado roga. So there is no disease which is caused by only one dosha. There will be the other doshas also take part in the manifestation of a disease. The same doshas like Vata and Pitta and Kapha, which produces diseases in an adult person, is also the causative factor of diseases in children also. So the medicines which are used to treat adults are also used to treat the diseases of Bala. Also, only difference is the dosage of the medicine, which has to be adjusted according to the age and the constitution of the body. Ta eva dosha dushyacha joradya vyadhyasya yel tadastadeva vaishajyam matra tvasya ganiyasi saugumadya alpakayatval sarvan anna anupasevana. Some of the common diseases of the children described in Ayurveda are briefly described here. That pathogenesis, clinical manifestation, course, and prognosis of most of the diseases are not altered significantly today. In this world, 3 persons are always under tension and enjoy and suffer from the spells of happiness and sorrow of the children. They are the baby, the mother, and the pediatrician. A pediatrician has to treat both the mother and the baby simultaneously from the time of conception till he becomes a healthy youngster. In view of the tenderness, dependency, and inability to express, the pediatrician should diagnose in infants and children with the help of all available data and his own observation. He should understand the baby's difficulty and administer appropriate, sweet, soft, light, pleasant, and fragrant medicine in calculated doses. Now, coming to the main problem, which usually is brought to a pediatrician, is allergy. Because in most of the diseases, the causative factor is an allergen. Many children become sensitized to things around them, that is, such as food, drugs, animal hair, dust, pollens, etc. And many show abnormal response to physical agents. Allergy is the term that is applied to this abnormal or altered activity of the cells and tissues. And increased susceptibility is brought about by a previous sensitization. Allergic reactions are the end result of antigen-antibody reaction. Allergy is a subject of great importance because every doctor, whether he is an allopathic, Ayurvedic, or any other system, will encounter allergic manifestation in his practice among children and adults. When we go into the details of the pathogenesis of diseases, we can see that many of the diseases are due to various allergies, starting from jara, kasa, shwasa, skin diseases, eye diseases, and so on. So, a pediatrician has to do a thorough study of the Nidana Panchaga by going into a detailed analysis of the Deshavitha Pariksha, like Dushyam, Desham, Kala, Balam, Kalam, Analam, Prakriti, Vaya, Tattva, Tatmya, Ahara, and Avastha, which will help us to reach a almost cause of the disease. And there is a important factor is a hereditary predisposition. Many of the diseases are hereditary in nature. In about 60% of the cases, hypersensitivity or allergy, there is a family history of allergy. A child has 25% chance of developing allergies if one parent is allergic. When both parents are allergic, the chances rise to 50 to 70%. Exposure to sensitivity factors by contact, like wood, soap, oils, cosmetic, rubber, feathers, etc. By inhalation, that is by pollen, dust, etc. The common inhalants that induce eczema as well as asthma and nasal allergy are house dust on floor, on chairs and beds and mattresses, etc. Wool, feathers, seasonal allergies like pollens of some trees or some plants which is growing nearby, especially this Bangalore and in our